that,
what
and that's called the VO2 max? Is that what that is?
Yes. So VO2 max, what it actually is a measure of how much oxygen our body is able to extract from the air and then use. And it's calculated in milliliters of oxygen per kilogram of body weight per minute. There's a spectrum of what is considered normal, and the way scientists or researchers have kind of measured people is we've decided to break it into quartiles. So the bottom 25th percent of the population, 25 to 50th percentile, 50 to 75, and then above the 75th is high functioning, highest VO2 max, and then they carve out the top like 2.5% and consider them elite. And when we look at data for risk factors for mortality, traditionally, if you go see your primary care doctor, they'll say, don't smoke, let's treat your hypertension, let's treat your cardiovascular disease, end-stage renal disease. These are the things that patients are readily hearing from their doctors. Uh, the actual data on how much of a difference those disease processes affect our mortality versus somebody who has low cardiorespiratory fitness versus the elite, the top 2.5%, the numbers are staggering. So smoking, for instance, in any given year of your life, if you're a smoker versus a non-smoker, your mortality rate is 40% higher for the smoker. So when you're 20 years old and you're a smoker, your overall mortality rate is something like 0.005. The risk of you dying is so low that if you're 40% higher, it makes no statistical difference. But when you're 65 and your risk of dying is somewhere around 4 or 5%, being 40% higher makes a huge difference. And so absolutely, your doctor is doing the right thing by telling you to don't not to smoke. Hypertension has a 20% higher mortality rate in any given year of life. Cardiovascular disease, 40%. End-stage renal disease is huge. It's about 178% higher risk of dying in any year of your life. So somebody who's on dialysis, they have pretty severe mortality risk compared to somebody who has normal kidneys. So when we look at the same data for someone who has a low VO2 max, the bottom 25th quartile, versus somebody who has in the top 2.5%, there's a staggering 404% difference in mortality. So in any given year of your life, the bottom quartile is 400% more likely to die than somebody who's considered elite VO2 max. Even if you're just in the top quartile, the difference is about 270%. Just going from the bottom 25th to 25 to 50th percent quartile, that carries 100% increase in mortality. So these are staggering numbers, and it does not take that much effort to go from the bottom 25th to the next quartile. And this is some of the gap in modern medicine, that we're very good at prescribing medicines for hypertension or high cholesterol or diabetes, but we don't know how to have the conversation with patients about how exactly would I get more fit? It's easy for me to say to a patient, you need to go to the gym, you need to lose 10 or 15 pounds. But that doesn't help the patient on how to actually do those things and what's the most bang for their buck, and what are the strategies that, hey, I only have 3 hours a week to exercise. How would I use that 3 hours a week? Because do I walk? Do I lift weights? Do I go for a run? Do I bicycle? Like there's no formula in modern medicine. Like in our medical education, as you probably remember, like we didn't talk about this stuff. This was not a part of our education, nor is it a part of residency training. And so unfortunately, this is the stuff that really makes an impact on quality of life and health span. And this is where the niche that I think my wife and I kind of identified is that we should be advocating for this type of treatment modality for patients. If patients know that this is where I'm at, this is where I should be, and this is exactly the plan to follow to get there, then we've really empowered them to make some positive changes.
You mentioned so much there, and I just want to dive back a little bit because
Sure.
I think there's a lot of people that may not, for me, actually, this was the first introduction that I had to VO2. Max was talking to you, is definitely one of those people that just, does my 10,000 steps, has my weight training and I guess pretty basic. So tell me how you mentioned that that's how you measure it. So is this something that has to be done? It seems like you need special equipment. Like, can you briefly explain to me how the VO2 max is measured and if someone can do it on their own?
It's not simple to do it on your own. There are some surrogates that you can use to estimate what your VO2 max is. So the ideal is that you're doing it the way that we're doing it, that there's actual machinery that is actually measuring how much CO2 you are blowing off and how much O2 you're actually utilizing. So there's a computer algorithm. The machine is actually directly measuring these two values, and it can tell really fascinating information. Other than telling you exactly how big your engine is, what your VO2 max is, it also tells you when you switch over, say, as you're walking and you're increasing the rate of walking or the incline, it can actually tell you, okay, this is when you stop burning fat calories and you start dipping into carbohydrates. And then you're exerting yourself so much that now you're burning fat, carbs, and you're breaking down some muscle protein to fuel yourself. And so we can tell patients that, if you're wearing a heart rate monitor or an Apple Watch or a Garmin or something, this is where your heart rates should be when you're exercising if you want to maximize fat loss per se. If you want if you want to train for VO2 max, then you need to do this type of interval training where you get your heart rate up to this zone for this amount of time, and then you rest, and then you do it again and get your heart rate to this zone. The machinery allows us to calculate exactly what a patient's fat burning zones are, as well as what heart rate zones are most important for maximizing VO2 max. These two things have to happen in different times. So there are patients that have no prior history of really doing dedicated exercise. The goal for them is to just get them used to exercising, and we want them to be in this fat burning zone of exercise. So as we measure their VO2 max, the machinery allows us to calculate, hey, this is the heart rate in which your body switches from burning fat calories to carbohydrates. When we're normally walking around, we're doing desk work, light housework, our body's only burning fat calories. It reserves carbohydrates for high exertion. It harkens back to fight or flight response. We need carbs for immediate energy when we're running away from danger or fighting. And so our body does not use that until we're highly exerting ourselves. All of the rest of the time, we're just burning fat. And so when someone's goal is, I'm just starting this journey, I want to start losing a little bit of weight, then we'll say, well, I don't want you to exert yourself beyond this limit because this is where you'll have the most bang for your buck on fat loss. And as you get stronger, physiologically stronger, and you're actually able to exercise, and let's say now you can stay in that zone for an hour straight, right? Whether you're just going for a fast walk or you're a light jog, you can do that for an hour straight. Now I think you're fit enough that we can start doing VO2 max training, because I don't want anybody to start a journey on this and get frustrated from day one because they tried doing this high interval exercise and it's so taxing, it doesn't feel good, and they're like, I don't ever want to do that again. So the goal is to gradually introduce exercise to patients in a way that it feels good for them.
And with the VO2 max training and with the fat burning, I'm assuming, because we all see on the treadmill that, oh, this is like the heart rate for fat burning. So I think I just like assume that, okay, if I'm at around 130, I'm going to burn fat. But what you're saying is it's more individual, that everyone's heart rate for burning fat is going to be different.